Hi, everybody. Like Megan said, I'm head up patient success here at MyEyes. So I have talked to many of you in the past. Some of you I actually just saw at the patient summit down in Dallas. So that was kind of exciting. It's nice to meet people in person. And many of you know Patricia and Doris and Kathleen, who are our patient ambassadors. They'll be joining us as well. So they'll be helping out with the chat. If you want to go to the next slide, Meg. So just some guidelines to start up. There's a lot of people here, or we had like 100 people sign up. So just please keep your microphone muted unless you're invited to speak or you raise your hand. To raise your hand on Zoom, and we're, like Megan said, we're going to try to make this really interactive. Our last one was kind of more of a lecture. It's not going to be that way. So you just go down to the little react button on the bottom. You can open the chat and keep that open. And then under react, you can see the screenshot over there that you just raise your hand if you want to speak. And Megan will bring you up to the front. Feel free, most of you have your video on. We want to see everybody if we can. If not, that's okay too. If you prefer not to speak and you're not comfortable, just type your question in the chat and we'll read it out loud or your comment. And please keep comments to just a couple minutes if we can. We have to cut at 2 o'clock Eastern time. So we just want to make sure we give everybody a chance to speak and share if they want to do that. And I just want to note too that, you know, everybody's got different backgrounds with their glaucoma and different treatments and different things that they've done. But no content in this webinar is considered medical advice. You always check with your doctor first before you make any changes. So the next slide. And like I said, this is an interactive session. So feel free to, you know, comment, ask questions, talk amongst yourselves. Like you can, there's a chat feature, you can talk to other people, and we'll just engage and see what we have to share. So I figured I'd start, what's in your glaucoma toolbox? I'm going to share my favorite tool in my toolbox, and many of you can probably guess that my favorite tool is actually the home tonometer. It's changed the course of my disease on multiple occasions. And really the best part about it is the IOP charts, which Megan will share. So these charts I take with me when I go to my glaucoma specialist, especially if I'm seeing spikes or fluctuations. These actually aren't my charts. Mine, I only have glaucoma in my left eye, so mine aren't as pretty as this one, but this shows you an example of one of our patients and their IOP when they tested for a week, kind of around the clock, and, you know, just shows where they were spiking, where they were, you know, fluctuating and what times of day. And then Meg, if you go to the next 2 slides, it charts it out too by left eye and right eye. It's just a great way to look at, you know, the times of day over the course of a week when you're spiking or fluctuating. So that's obviously, like I said, y'all who've talked to me in the past know I'm a huge proponent of home tonometry. And it's just been invaluable in my disease progression and stopping the progression. So I'm gonna throw it out there to the group and see if somebody else would like to share what's in their toolbox. And you can raise your hand.
Sure.
Or type it.
This is Daniel. I'd like to share, but I don't know how to raise my hand.
Oh, that's okay, Daniel. Go ahead.
So I'm Dan Taylor. I had glaucoma for about close to 20 years. And so we've been looking for a way to, I've had a couple of surgeries. We have tubes put in. It's a total of 3 surgeries over the last about 8 years. The tubes and the more in the last 1.5 to 2 years still have high pressure. And my peripheral has been decreasing, but my doctor came up, asked me to try your program, because when I get into his office, I'd have high counts, and when I leaned up towards the machine that's bolted in the floor, I'm not sure what it's called, I would get a high number in like, mid-30s. And then when they used the handheld instrument, when I was leaning back, for a little while, they would drop, remarkably. So it kind of played exactly what I'm experiencing. And I think been talking with your technical people there, I forgot what her name was last week when I got this, is that it's really interesting to be able to really plot and see that there's maybe some key times or functions or activities in my life that you need to be more conscious of, like the elevation of your head, like working on computers or driving. So I don't know if that was the type of information you're looking for or not.
Yeah, absolutely. I mean, I think the activities piece of it, like some people do yoga, some people exercise. I know a lot of people, I know for myself, I find that my IOP goes down after I exercise. I probably won't do it as much as I should, but it definitely is impactful for me, and everybody's different. But definitely like that type of thing is, and being able to know what affects your IOP is really key, I think.
Yeah, so it's no pun intended, real eye opener for me, because it's just really been this doctor is incredible. But we just doesn't seem to understand why I can, every 4 to 6 weeks, he comes in at these high readings. I'm not losing any visual field. And it's, I can feel, some dryness in the eye and pressure. But one thing I have discovered, yours is exercise, so you should probably be exercising all the time. That's what I need, because I should be exercising all the time. Unfortunately, the trend I'm seeing is that when I meditate in the morning for 20 minutes, my head, my points are jumping by 6, 7, 8 points just during that 20-minute period. That's during just transcendental meditations, sitting still. So I guess I probably need to get up and do more moving around. I sit still is not good for me. I don't know.
For sure. I'm in the same boat for sure. And we have a couple comments here. Let me see.
Yesterday we couldn't breathe, it was so hot. Now today is 71 and it's chilly. Can you believe this weather? It's unpredictable.
Erica, I'll just quickly mute, so just look to unmute yourself.
Let's see. 75. Yesterday was 90 something. Today is 75.
Me too. 1 minute.
Oh, bagels again, huh? Laura sends those. I really like those.
Okay, I think I got it.
Okay. Can everybody still hear me okay?
Yeah.
Okay, great. So Carol shared that she uses a home tonometer, a small thing, but she bought a device that she puts on the bottle of drops. It makes the drops the same size, and it keeps her from flooding her eyes with drops. And it's called I'm pretty sure, Carol, you're talking about the NanoDropper. And like I mentioned, I was just down at the patient summit, the Glaucoma Patient Summit. It's put on by the Glaucoma Research Foundation in Dallas, and NanoDropper was there. And I've seen several presentations about it, and it really helps not only keep you from flooding your eye with drops, but also it helps save money, right? Because these drops are expensive, and they find that you really need a smaller size drop, and it's just as effective as a great big drop. So the NanoDropper is a great tool for that.
Do you have any suggestions, Erica, on where to buy the NanoDropper?
I don't know if it's on Amazon or not, but I think if you just Google NanoDropper, or we could probably get that link.
Yeah, it looks like it's on Amazon.
Yeah. Is it now? That's great.
Yeah, I see it for $17.99.
There
I
were
think
also,
sell it from their site, it looks like too.
there weren't, they weren't at the summit this last time, but there's also another device. Meg, maybe you could find it, and it actually helps you to put the drop in. It's kind of goes across the bridge of your nose, and it helps you align the drop properly. And that was really cool. I saw that last year. Let's see. Someone asked about the charts. Leanne asked about the charts, and yeah, we will put a link on there. So anybody who has the home tonometer, if you, like I said, we'll put the link on there, and then you can go in, and it's the same login as the app, and you have access to all of those cool charts that I just saw. So
And I just popped a quick poll in to try to help us understand of the people here who owns a home too, who's rented in the past, or who just hasn't ever tried it out. If you guys see the
yeah. And Cynthia, okay, she answered that. Cynthia asked if you can add to the charts. Right now, you can't add to the charts. It's software that's through iCare who makes the device. But I'm hoping in the future we will be able to. But even if you don't have a home tonometer, you know, I think it's helpful to have a notebook. A lot of the people that I saw at the summit last week, they have a notebook that they carry with them and they take to their doctor's office. I was part of a panel and we talked about empowering patients and what you should bring to your doctor's office when you go, especially if you're transitioning from, you know, a regular optometrist or ophthalmologist, and you're now seeing a glaucoma specialist if you're just recently diagnosed. Yeah, that's great, Meg. And just being able to chart everything and chart your IOPs and, you know, the results of your tests. And, you know, it's just really, really important. I think another big tool in my toolbox is questions. When I go in, if something's going on, my disease is a little complex and there's a lot of different parts to it. So I'm always careful to add, you know, questions to my notes. I take notes in my phone and take it in and make sure I ask all the questions and make sure that, you know, the specialist, whoever I'm seeing, I see a few different ones, that whoever I'm seeing knows what's going on with the other parts of my disease, but also knows that I have questions and, you know, they need to take their time and answer all the questions. You really have to advocate for yourself.
Ericka, it looks like Peter raised his hand and wanted to speak. Peter, I put you on the stage with Ericka. If you can unmute.
Hi,
Sure.
Peter.
Hi. Just a comment about the NanoDropper. Yes, it is available on Amazon, and they have a sort of two for slightly less, although it's very expensive, I think. But it's probably worth it. It's worth it for me for the following reason. I'm very allergic to benzalkonium chloride, BAK, which is in almost all of the drops. Now, I have managed to identify and get some drops using 3 or 4 meds that don't have benzalkonium chloride in it, but 1 or 2 you just can't. They just don't make them, at least in the U.S., without benzalkonium chloride. The advantage of using the NanoDropper is that you're actually putting much less drop in your eye. And as a consequence, it works just as well, the amount that you put in, but you're putting in much less. And so less benzalkonium chloride means I have less keratitis, less blepharitis.
That's a great point. And again, the cost savings, you know, some of these medications, especially the newer ones that aren't covered by insurance and people are paying out of pocket for them, you know, if you can make it last an extra 2 weeks, that's definitely helpful. Anybody else? Any other things in our toolbox that anybody else would like to share?
I've got Dan Bogart who raised his hand. I'll get him up here. Hey, Dan.
Hi, I'm not sure if this is a toolbox question, but sometimes I have the home tonometer, and sometimes I'll use it, and then I'll use it a minute or 2 later, and I'll have a different reading. Sometimes a few points, typically a few points lower, occasionally a point higher. Does anyone else have that experience and have any idea what's going on? Is there some kind of anxiety effect that is associated with the initial reading? But I get I don't always get the same reading if I try it within a few minutes. So I wanted to ask if others have that experience.
I've definitely had that experience, but I've had that experience in the doctor's office as well. So it's funny you say that, because as we were at the summit and we were letting people use the tonometer, we would take their pressure and it would be high, because I think there is a level of anxiety that, you know, when you go to take it, same with, you know, the doctor's office, like we've all been there, right? You're sitting in the chair, especially if you don't have a home tonometer, you're sitting in the chair, you know, you're maybe there after 3 months and you're just kind of waiting, like, is it going to be good? Is it going to be bad? It's all about that number. And it's definitely anxiety provoking. And I've seen the same thing, or you're holding your breath. There's so many things that can change your IOP within seconds. You know, if you take it when you get up in the morning and you're laying down, and then you take it when you get up again, you may see a drop in pressure. So I'll throw it out there to the group though. Does anybody else see that with their tonometer, even in the doctor's office?
I think I saw in the chat that Cynthia Bonner mentioned that it happens to her too.
Mm-hmm. Yeah, I mean, I think the thing to remember.
So I have a follow-up. Do people take the lower number as the truth? I mean, it's psychologically better. I mean, I have had that happen.
I do. No.
So yesterday I had a 20 and then I had an 18, and I thought to myself, well, I'm going to call it an 18 in my mind. But in my chart, it's of course an 18 and a 20. But anyway, I'd be curious to see what others do. They choose the low number?
I do. I can tell you I do, like, because it just makes me feel better about myself, right? So, but I will say that with a tonometer, even in the office, you know, if you're getting it taken with a Goldman, it's kind of an average. So with the tonometer, it takes 6 quick measurements and it throws out the high and it throws out the low, and then it averages the other 4. So, you know, it's crazy, because within that, you know, second and a half that it takes the measurements, that your IOP could actually fluctuate in that time. And other things affected as well, certainly in the doctor's office. Sometimes the numbing drops for some people. I mean, I think it's just important to know kind of where you sit typically. And if it's within 5 points of where you typically sit, you're probably, you know, at least for me, I usually kind of take that as, you know what, I'm good, because it could go up or down a couple of points either way within a minute, 2 minutes. But breathe. It's funny, because I was saying to somebody the other day that, you know, when you're sitting in the chair and you're waiting for the big blue light, and the blue light's coming at you, and you're like, you're holding your breath because you know, it's anxiety provoking, but you don't want to hold your breath because that can raise your IOP. So it's just important to really do, I think, to your point, Dan, is, you know, breathe, like doing breathing exercises. And we had done another webinar on relaxation techniques and meditation, and they're very effective for lowering IOP. Cynthia's got a question.
Yeah, not so much a question, just going with what Dan was saying. I tend not to take the pressure a second time, because then I'll start to doubt all of the numbers. So I just, if I don't like the 20, or, you know, using his example of the 20, and if I don't like it, I just have to deal with it. But if I take it again and it's 18, then I'm going to be like, okay, what does that mean? And I'll start questioning everything.
That's a great point. There's a whole psychology that goes along with glaucoma. I keep saying that, like, it's just, you know, it's almost different than, you know, blood pressure and, you know, glucometers if you have diabetes. And it's just, you know, when it's your eyes, it's just very real, and it's right in front of you all the time. So it can be a little more anxiety provoking, I feel. Other comments? What's in everybody else's toolbox?
This is Dennis. Can I add to it?
You sure can, Dennis. Hi.
Hi. I just wanted to say I get the single drop vial or the single use vials. And I get almost 4 or 5 days out of each one. And so that's really dropped the cost of the Lumigan for me.
Oh yeah, with Lumigan, yeah, that can be really expensive as well. Yeah.
And one of the reasons I bought the Home 2 was so that because I was using them for an extended period, I wanted to make sure that they were still effective. And that made it very nice and easy to do because I buy them. If I get a 90-day supply, they actually last for over a year. And sometimes it's past the due date or the best buy date, but it still seems to work fine.
Yeah. I mean, I would definitely talk to your pharmacist about that as well, and just, make sure that, you may not want to use it past the due date, but still, from a cost savings perspective, it definitely, there's a lot of tips and tricks that you can use to save yourself that money and time.
But I keep the drops in the freezer, and then I pull them out a week at a time when I need them.
Yeah, I find too, like part of my disease is cornea related. And so my cornea gets really, really irritated. So I keep my drops in like the refresh drops, just the lubricant drops. I keep them in the refrigerator, and it's just more soothing when you put them in. Hannah, do you have a comment? Oh, hang on one second. We'll unmute you. Are you there, Tana?
She's trying to figure out how to unmute.
Okay.
Should be on the bottom left corner.
Sorry about that. I may be a little late to the party, but I rented a tonometer a couple of years ago at my doctor's request, and my pressures have always been low. And I guess I have two questions. One is that so the tonometer gives me the reading. After I get a reading, what can I do about it? I guess is the first question. How do I use that information? What are my action steps? And then my second question is for those of us, and I don't know how many of you there are out there who have low pressure glaucoma, are there particular tools available?
So great questions. I can tell you my experience, and I kind of have both because I have two shunts in one eye, but one of them's a Bearvelt. And so after a Bearvelt shunt, a lot of times there's another poll question up there too. A lot of times the pressure will go really low. Like after 6 weeks, it opens up, and it really opens up. Like I went from like 13 to like 3 overnight. And which isn't a bad thing because that was the goal, right? So but as far as the readings go, I mean, the way I use them, I mean, I don't run to the doctor every time I get a high reading. I just kind of helps me to know, like, if it's at night, like I work out a plan with my doctor, and I think that's really important when you have a tonometer or you have a tool like that. And my doctor and I have an understanding that, okay, well, if, I find that my pressure's high, if I get a high reading, the other day I got a 22, which was high for me as of now. So I monitored it over the next, 24 to 48 hours, and just kind of took it every little bit and realized that it was just a fluke. But if I needed to, I could have added a drop I take one drop at night, and I could have added it in the morning. But it does help give your doctor information about, maybe you're taking your drops in the morning, but you're spiking at night. So it really can help, especially if you have a chart like that. It helps your doctor kind of figure out where you're spiking and fluctuating. How about everybody else? How do you use the information? See, Homer's got his hand up.
How do we put our hand up? I forget.
You got it, Jean.
Oh, it's on my own hand.
It's your own hand. It worked.
Do you want me to speak or someone else? It's someone else's turn, I think.
Go ahead, Gene. Homer's waiting. He looks pretty patient. He'll wait for you.
Okay. Yes, mine has been spiking in the morning. And my doctor didn't like the fact that when I came into the office, the pressure with his machine was always perfect. But at home, it wasn't. It kept going up and down with the tonometer. And so he's going to do a laser on one of my eyes. He's not even sure that's going to work with the spikes. And if not, then there's something else he will do, which then he has to do in the operating room. I don't remember the name of it, but yeah, so I think it helps. He did take me very seriously when he saw my figures of how it went up to 23 and even 24 in the morning. Now, I don't know if a lot of people's goes up in the morning after they've been lying down all night, but he didn't like that. So he's going to do a laser on me, and we'll see if that works. An SLT.
Well, good luck, Gene. It's good to see you again. Gene was at
Thank
the
you.
summit last week. It was great to meet you in person.
Thank
Uh,
you. It was great to meet you too. So I
Well,
hope this
yeah, and it
works.
was such a great,
What? I was going to say that it really
yeah,
helped
good luck,
to have
Gene.
the tonometer to be able to tell the doctor how it spiked when he didn't know. When he first came in, he said, "Well, I guess you're doing really well." And I said, "I don't think I am," because I showed him the numbers and he said, "Oh, that isn't good." And so he decided to do a laser on me. So the tonometer really helped. Nobody would
Keep
have known.
You wouldn't have known.
No.
And that's kind of how it was for me too. Like I had one shunt and we knew I needed a second shunt. The first one lasted for 8 years, which was great. And, I was like in the 20s in the office, which for me wasn't terrible. And one of my specialists, so my disease is really rare. So my doctor was sending me to a bunch of different specialists to kind of figure out what shunt to do next. And one of them said, you should rent this home tonometer. I'd never even heard of it. Obviously, it was way before I worked for MyEyes, but we found that my pressure was spiking into the 40s. So what we thought we had like months to kind of figure out, we didn't. And it was like all hands on deck. And I had surgery like 2 weeks later. So it really paints a picture and tells a story. But then again, like I said, I was in the 20s. One person's 20 is another person's 30. So it just depends on how your body handles a higher pressure, and some people can handle it and some people's optic nerve can't. So Homer, you've been so patient. Speak up.
There we
There
go.
you go.
Thank you. Let's see, how can I'll start with that. I have low tension glaucoma. I think my IOPs were running around 15 before they discovered my glaucoma, and now they're running anywhere between maybe 9 to 12. So what I used the tonometer for was let's see, how can I put this? I heard that the IOP increases when you're sleeping. So I rented the tonometer, and then I kind of woke up throughout the night to take readings. And I did find the readings go up maybe two to 3 points while I was sleeping. Of course, you're waking up, so it's not the best, but it did seem to increase. I also had problems with the tonometer because when I woke up, I had dry eyes, and so it was hard for me to keep my eye open for it to take a reading. So I'd have to take it maybe 3-4 times, stuff like that. And then, of course, I don't know if the readings started out somewhat high and then went down as the dry eye kind of decreased, maybe. But then again, I don't know if that was the dry eye is indicative of high or was interfering with the readings, if any of this is making any sense. But then I read something about using a wedge pillow. So I got one of those, and I also took readings, and it seemed like for me the wedge pillow did decrease my IOP because I took those readings while I was sleeping or using a wedge pillow, and it seemed to have dropped the IOP by maybe 2 points. Again, who knows? But so I suggest that possibly as a tool is a wedge pillow.
That's a great tool, actually. I've talked to a lot of patients who use those.
And oh, one other thing, exercising. I lift weights, and I've heard that lifting weights could cause eye pressure to go up and stuff, except maybe excessive weights or whatever. So I took the tonometer to the gym. I do an exercise routine. I take go into the locker room and take a set of readings. And I found that, at least with the weights I used, which is not an excessive 100 pounds of weights, but I didn't see any increase in IOP with me lifting weights. Again, I didn't do any excessive weights. So I think that's it.
Right. Thank you for sharing. Yeah. And again, everybody's different. So yoga, I mean, I think they say that, downward dog, anytime you're bending over and your head is going below your waist, that can be, it can raise your pressure. But again, everybody's a little bit different. Jean, just unmute yourself down in the corner.
In one of the lectures at the patient summit, one of the doctors said that when you're lifting weights, don't hold your breath. And that will help you not to have your pressures go up. So just don't hold your breath when you're lifting.
Yeah, it seems to me like I've heard that a lot from a lot of different, it seems like each summit, I've been to the last 3 summits, and it seems like that's a hot topic. Definitely breathing or doing like some kind of meditation or yoga, that kind of thing. But holding your breath will absolutely raise your IOP. Cecilia.
Oh, okay, sorry.
Oh, sorry.
Sorry. Cecilia, you can talk. Yeah.
Oh, thank you. Well, for me, my pressure, I got a home tonometer, and sure enough, my pressures increased at night, really high, not just a few points, but really high. I also noticed, I thought, what am I doing at night that I'm not doing during the day? I noticed that I'm really stuffy at night. So I got on the glaucoma support groups, and it seems like a lot of people have allergies and stuff and when they're stuffy, that increases their eye pressure. My head was feeling like it was going to explode. My nose was stuffy. My ears were stuffy. So someone suggested Afrin nose spray, and that seems to work for me and not increase my my IOP. But I limit it because I have to be careful of it as well, like anything else. But that was a great tip for me there because it did help relieve some of the pressure.
That's great. That's a great tip.
Okay, can I share?
You sure can.
Okay. I just have this thermometer about like 3 months, and I really enjoy using that. And I shared all the results with my doctor. And I have a similar situation. One of the situation as you, I have Sean too. I have 2 of them. So I think I found is a lot of people mention that during sleep and the pressure will go higher. And the reason I was really curious about that is because my pressure, as someone mentioned, you see doctor and doctor during the daytime saying your pressure of about 12 is pretty good. Every time I see him in the morning, afternoon, it's a 12. He's satisfied, he's happy, but I just feel like gradually progressive. For a few years, I just feel like what's causing that? And then until I got this thermometer, and then I was measuring during the night, midnight, like 2 o'clock, 3 o'clock, and my pressure can shut up by like going by as high as a 7 point. So so my doctor really surprised. He said, "What's going on? And how can that happen?" Then I tailored my medicine. I asked him. I tailored my drop to be concentrated during the night. It seems a little bit better improving that, but not completely reduce that. So the highest I can get maybe 17, 18, but if I do that, I can get probably 15 combined with I'm wake up and I'm walking for 15, 20 minutes. The reason is I think maybe it's because of the sound. So I provide all this information to my doctor. He never had this kind of information before because maybe sound is different when you lay down. It is, the flow was not going very smoothly or something. So he is very curious. Every time since then, as he said, saw me 3 times, he really looking forward to see the data from thermometer. So I show them every time I present to him, and so and then I ask him. I say, "Do you know any patient have the shunt have a similar experience?" He said, "None of my patients have tonometer yet." So that's the problem is it's not very popular people using that and getting more information about that. Um, I'm not suggesting people wake up during the night like me to walk. I walk really walking and for about like 20 minutes and my pressure will go down even I don't do anything. So exercise really help low down the pressure. As far as for exercise, every day I'm running. When I was running, I can go down my pressure by 4 or something like that. So it is very helpful. But you cannot constantly running, right? So and I was just saying you can go down, but during the night it's still going up. So I need to figure out why it's doing that. And even I was concentrate all my drop during the evening and night. Even I wake up by using drop, I still cannot control that. So something was it's a very strange and but I do enjoy using this tool to give me information, help me to control my pressure. And I fortunately I can wake up and fall asleep right away. So other people probably don't can do that. So I
I'd
just
be up
want to
the rest
share
of the
that.
night,
Yeah.
personally. But yeah,
Yeah.
no, and I've done that though, where I've had to get up, like if my pressure's spiking or I feel like my eye is something's going on, then I do that. I get up in the night and I'll take it. It's amazing how quickly you learn how to take a reading in the dark in the middle
Yeah.
of the night and are able
Yeah.
to do that pretty quickly. But the nice thing is that you have that information and you can go to your doctor because maybe it's causing progression, but maybe it isn't, right? So, you can take all of that information, you go to your doctor, and then they do other tests like the visual field or they do an OCT, and they can look at everything and be like, hey, you know what? It's not affecting the progression of your disease, or it is affecting the progression of your disease. But that's just such a great thing to be able to have that, and the doctor has a clear picture of what's going on.
Yeah.
Yep.
May I speak?
Yeah. How are you?
Yeah, I'm well, thank you. I had your tonometer for a short while, okay? Now I have a very advanced case of glaucoma in my left eye, and in my right eye, it's not so bad. Now when pressures are measured, even in the doctor's office, the pressure in the right eye tends to be higher than in the left eye, okay? Which sounds kind of strange. But anyway, so I tried using the tonometer, and with the left eye, I never could see that blue circle. I mean, there were people from your staff online with me and giving me all kinds of tips and stuff, but I never could see the blue circle. Now, with the right eye, I could, so I assumed that I know how to do it.
So, and then finally, they suggested that I may as well return the instrument back to you, which I did. But one of the problems, though, is that I mean, okay. So my first question is there any suggestion or opinion as to why I could not see that blue circle, and is there any way around it?
So, and we do, like, I will say that a home tonometer is not for everybody. You know, if you have a hard time, like with hand movements and things like that, that can be trickier. What we usually suggest is you can look in a mirror. And if you look in the mirror, you can see the reflection. So you know when you've got that green circle, and then you can take your measurement then. Or if you have a caregiver that can help you, they can usually see, like when I'm demonstrating with people in front of me, you know, I can see the light turn from red to green. And
Okay,
then
I don't have a caregiver. And as far as a handshake, I probably don't have that because I can measure it with the right eye, for the right eye perfectly well.
have you tried looking in the mirror so you could see the reflection and you can see the light turn from red to green?
Did I look in the mirror? No, I didn't. No one suggested looking in the mirror.
Yeah, you can do that. You can because especially if you're taking it in your other eye and you can kind of see, you know, in the reflection, you can see the light turn from red because you can see it reflecting in your eye. And we recommend doing that. I mean, it's not always successful, but that's another tip.
I don't have a camera, but when I got your tonometer, it took me like 3 days to learn how to really use it and see. And yes, I had a problem with my right eye, and I really had to put it close, and I really had to juggle it around to be able to get it where it needed to be. But I was finally able to do that. It just took a lot of work. And every time I used it for that eye, it's the same thing she was saying, that she could never see it. But I finally could if I just kept moving it around, and I could finally get it adjusted to be able to get the measurement. And I don't have a camera on this laptop, so I'm sorry.
That's okay. That's okay. It's good to hear your voice, Patricia. Yeah, I mean, everybody's a little bit different. It took me some time to get used to it. It's kind of like muscle memory too. So like I could get up in the middle of the night now, boom, bang out a
Right.
you know, measurement. But the funny thing is I measure my left eye mostly. I rarely measure my right eye. So when I go to measure my right eye, sometimes I'll get an error message because I'm not holding it the same way because I'm just not used to measuring that eye. So it definitely takes some practice, but once you get it, it works pretty well.
Right.
How about anybody else? How about let me throw this out there. As far as like groups or, you know, where does everybody get their information other than your doctor? Like where are you guys part of any groups? Like I know there's the Glaucoma Foundation, the Glaucoma Research Foundation. Like I said, I just came back from the summit. If anybody's ever able to go to that, it's wonderful. Jean, I know you could speak to it. Next year, this year it was in Dallas. Next year it's in San Francisco for all you West Coast people. And you go and it's usually an afternoon and then a full day the next day of talks and panels and other glaucoma patients and doctors and caregivers. And it's great. I highly recommend it. But where does everybody go for their information or community groups, that type of thing? Oh, Dune, just take your...
Yeah, I read everything that the Glaucoma Research Foundation publishes. And I've gone to a couple of their sessions, and I've had some interactive meetings on Zoom with a couple of their speakers. I also Google stuff, and so basically reading is mainly thing. And I was diagnosed with glaucoma in 2002. So I've been with it for a long time.
Oh, that's a long
I'm on to my 4th doctor now. And the previous doctor was recommended to me as the best in our local area. And when people don't get help from anybody else, they would go to her and they got help. But she basically couldn't help me either. And and what she said was, and all these doctors basically said that they would not do any surgery on me because they felt that the risk of doing the surgery was greater than just leaving it alone.
Yeah, that's so hard. It's hard to get that information too and get that, you know, that news, if you will. But I think you bring up a great point that, and we talked about this at the summit as well. You know, what do you do when you and your doctor just don't gel? Like, you know, how does everybody handle that? Like, you know, I mean, it's like that with any doctor. It doesn't have to be a glaucoma specialist. It could be your primary care. But, you know, there comes times when, you know, you may feel that they're rushed or, you know, it just doesn't click. So what does everybody do in that situation?
Yeah, I'm not faulting the doctors, okay? Because all of them said the same thing. And all of them were highly qualified doctors. So, but basically the general conclusion seems to have been that there's nothing they can do to help me other than put in the eye drops. And one thing that is upsetting on that is that when I do the visual field test, you know, the right eye so far has been stable.
Oh, that's good.
Yeah. And the left eye keeps going down very gradually. And also I should say that when I started, this was after being on drops for about a year, my eye pressures used to be 10, 12. Okay, and then they have crept up since then, and now they hover more like around 18.
Yeah.
But the visual field test has not so far shown much deterioration or any deterioration for the matter.
That's good.
So we'll see if it holds up.
Yeah, keep us posted for sure.
Interesting to see all the resources in the chat that people.
I know.
And
we have a link to that presentation, to the meditation presentation we can put in the chat as well. Somebody else had their hand up a minute ago. Do we?
Cecilia, I just put her back up. Cecilia, if you had a question or comment.
That's what I was going to say is that there are some Facebook glaucoma, you know, support groups, but I always ask my doctor first. I don't always just take their suggestions because I always go through my doctor. If something sounds good, I check with him first. Another thing I was going to tell you on that tonometer, if my eye pressure is really high on one of my, because I have the problem where my right eye is the problem. If it's really high in my right eye, I cannot see the circle. It looks more like a lava field. So sometimes knowing that it gets high, I go ahead and take my drops and then I go back about 10 minutes later and try the pressure check again, and it works. So that helps knowing that it was high, and it helps reduce that, you know, knowing that I need to get it done.
That's a great point. Great point. And yeah, I can't reiterate enough that, you know, you read all this stuff, you take this supplement or do this or do that always, always, always go through your doctor first. Dan, you had a comment?
Yeah, I just want to say for my toolbox, I think the thing that has been most successful for me is light exercise, walking. And I've almost become, I feel, addicted to it. I walk early in the morning right away. I walk in the midday. I walk in the early evening. But I check my pressure after, and it generally goes down a couple of points. So walking has been a godsend for me, maybe for others too.
Yeah, I hear that from a lot of people, honestly. And it's not even like, you know, heavy exercise, it's walking. How about anybody else? We've got a few more minutes here. So one person, Mona, commented, I've been twice interesting comment. I've been told that it's like a car going downhill and we try to put on the brakes, but there's nothing anyone can do to slow or stop the progression. I get a feeling many of them simply do not know what to do, so they just let it take its course. And one of the glaucoma specialists in her town told her that she would go crazy with a tonometer reading, so better not use that. So, I mean, everybody's different, and there are definitely people out there, no matter what your disease state, that maybe too much information is too much information and it's anxiety provoking. And I do think there are still some doctors out there that kind of feel that way, that they feel like you're going to call them in the middle of the night if your pressure spikes, or, you know, you're going to be calling the office every 5 minutes. And, you know, we try to reassure doctors that that's not going to happen, but it's really hard because you need a prescription for this. Like anything, it's really hard to get doctors to change their prescribing habits, especially if they've, you know, kind of been set doing one thing for a long time. But, you know, I liken it to blood pressure. And, you know, you wouldn't, you know, do bypass surgery based on getting your blood pressure reading once every 3 months, right? So, or same with diabetes, you wouldn't, you know, just take it once every 3 months in the middle of the day and just say, okay, now we're going to do this. We're going to start this medication. So, you know, it definitely is changing the way that glaucoma is treated. And I think, you know, again, it's not a newer technology. It's been around for a long time, but it's just getting doctors to kind of understand how patients are using it. And like I said, it's not for everybody, but for those who can use it, like those on the call, you know, it's just, it gives you invaluable information.
I have a question regarding massage.
Mm-hmm.
Pressure down. Is anybody familiar with that?
Has anybody had any experience with massage?
Yeah, when you massage.
I have not. Yeah.
Massage yourself.
So I apologize for just unmuting, but I haven't been able to find the hand to raise it. So I'm sorry. But anyway, yeah, so massage. I was very nervous about having a flat massage. And so what I did was I sought out a provider who actually comes to my house and brings the chair. And she does a chair massage for me, so I'm not laying flat. And I just had one last week, and I checked my pressure after, and it was still within my range. So I may get bold and make an appointment for a flat massage and take my tonometer and check my pressure after. But this lady is so lovely, and the massage was so awesome that I may stick with her for a while. So,
oh, that's awesome. That's great information. Can you send her to my house, please? Really nice.
And the other thing I was going to say real quick, I had put in the comments, one of the things I found, I have dry eye, so I have to use drops all the time for the dry eye as well as the glaucoma. I have found that a moist mask will help, and I use it while I meditate. So it helps my dry eye, but it also helps my pressure. So it's kind of a win-win situation. So.
Yeah, I found that too. Warm compresses definitely help, because I think, you know, just the nature of having drops and doing drops all the time, it is very drying for a lot of people's eyes. It certainly is for mine and my cornea. So yeah, the warm compresses are awesome. And there's a lot of products out there now that are for like they're warming. You can actually put them in, you know, the microwave, that kind of thing.
Hello?
Yep. Hi, Tana.
Hi, I am wondering if anyone has any thoughts about sleep position and how it may affect the pressure. Whether sleeping on your side or on your back is better.
This is Carol again, and sorry about not raising my hand, but I've done a lot of work with that because when I'm a nurse as well as a glaucoma patient. And when I first started reading, I read a lot about eye pressure. I found that if I sleep flat, or even if I use 2 pillows, my pressures go up to where we're not comfortable. So I put in the comments, I know they're expensive, and I tried the wedges and I cannot sleep on the wedges. So I finally just bit the bullet, got a sleep numbers bed, and I keep my head of my bed up about 20 degrees, and it does keep my pressure within acceptable range. I've woken up during the night a number of times when I first got it and checked my pressures, and they do go up, but it's still within my acceptable range. So it was worth it for me.
How about sleeping on your side? Does that do anything
Yeah,
special?
I'm a side sleeper, and it did make my pressures go up. So unfortunately, I'm trying my best to sleep on my back.
I'm a side sleeper too. Huh. Thank you.
Thank you. And people are asking if we can summarize the chat, and we will absolutely send that out to all the participants, especially the recording. So you'll have all of that. And please, there was just a poll question that came up that asked what you would like to talk about. If there's other topics, we'd really like to do one of these a month. So, you know, if you have anything, any hot topic, any hot glaucoma topic, we would love to cover it. And even, you know, maybe getting a doctor on board and being able to share with patients and get your feedback would be great. But I want to thank everybody for being here today. It was a great conversation, I think. And you know, a lot of participants, which is great. If you have any questions, the graphic is up there about email us at support@myeyes.net. Our phone number's there. Patient ambassadors are here. Most of you have talked to them at one point or another. So, and we have a new ambassador, Kathleen. So call and introduce yourself to Kathleen. So, but yeah, just want to thank everybody and have a great rest.
Thank you.
Thanks all.
Thanks, everybody.
Thank you.
Thanks.